When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank. Cordlife. One chance, one choice.
Hi everybody, a very warm welcome and good afternoon. Thank you for joining us this afternoon on this webinar, which is targeted at labor pain management and how to cope. I think as a new mother, as an expecting mother, one of the biggest fears that we have is what is labor all about? And that's what we're here to remove a little bit of those fears to make it feel a little bit more normal and natural. I also have the pleasure, I'm going to do my introductions later, but I have the pleasure of having Dr. Ashima Kaur from DMC Hospital with me here today. She's my special guest, and I would first like to hand over the mic to her so that she can, address everybody, welcome the audience, and then we'll get started on the conversation for today. Over to you, ma'am.
Yeah, good afternoon to everyone. And I hope we are not disturbing everybody's schedule on a Sunday afternoon. I am sure that this will be fruitful to you. So as Sonali said that the fear of labor and what labor is all about, it is very essential that we sensitize during pregnancy, because only then we will be able to carry you through the pregnancy and you can have a fearless delivery. So the labor pains, they cause a lot of stress to all the patients, and that stress comes in the 8th and the 9th month. So if we are able to take out your fears in the early pregnancy days, it would be very nice. So I'm just introducing you to the topic of how we manage this. So the first step should be during pregnancy, no stress factors, and you start your, you continue your physical activity, and plus whatever is taught today, please try to follow that. That is for the antenatal part. We must make sure that you do not gain excessive weight and you are active throughout the pregnancy so that the delivery becomes easy. And at the time of delivery, we do demand a COVID test, but not to worry about it because that's mandatory by the government, so that we can find out that you and the baby is safe. And once you are admitted with us, we do have painkillers to decrease the labor pains. So some are simple injections and some injection which is called epidural, which is given at the back. So you can opt for such labor pain injections. Plus, what is going to matter is your mindset. If you have worked enough during pregnancy and you are willing for a vaginal delivery, you will not suffer so much of labor pains. So the stress factor during labor would be less, and there should be somebody along with you who could support you through the labor pains. So you should have rapport with somebody and bring them to the hospital so that we can carry you for a normal delivery. So I will not take long. So what I want to pressurize is that this is a very valuable deliberation today. So try to pick up as many points as you can and practice it till the delivery, and all the best for today. Okay, bye.
Thank you so much, ma'am, for those insightful words and the inspiring words and getting all the mothers geared up to start listening. So let me set a little context for today's session. This session is going to be recorded, and this recording will be shared with all the participants. If you realize you are not able to speak, you have been muted, and you will not be able to unmute yourself. But that doesn't mean we don't want you to ask questions. So in your dashboard on the side, you will see a question box. So click on that, and throughout the session, you can keep putting your questions there. We will be answering questions at the end. So whatever questions you put in there related to pregnancy, labor, if you have any other doubts in the pregnancy and birth space, we would be really happy to answer those. So put your questions in. We'll make sure we answer all those before we close the session today. Right? The session is slightly longish, more than an hour. So being comfortable is very, very important. So make sure that you have a lot of pillows, you're comfortable, you're rested. If you haven't eaten your breakfast yet, which can happen on a Sunday morning, so grab something to eat, keep a bottle of water ready. If you need to visit the bathroom, please do so. So please do so. And most importantly, it's a Sunday. So if your husband is at home, then you can invite him to be a part of this session as well, so that he can also listen to this and he can be an effective labor support person for you at that time, right? So I'm going to give you just a minute to get all this organized while I start sharing my screen, and then I'll introduce myself and take this forward. All right, so awesome. And now that I have set the context for today, let me also introduce myself. My name is Sonali Shivlani. I'm a pregnancy and postnatal consultant, and I also work with child nutrition. I have been in this space for almost 17 years now. I'll be completing my 17th year in the month of May. So it's been 17 years to my journey, and it's been an amazing journey. I've had the privilege of working with more than 40,000 families and done workshops almost in every part of India. COVID has actually increased the reach as well, because we've been doing webinars extensively, and we are able to reach more and more families in this fashion as well. Today's session has been brought to you by Cordlife in association with DMC Hospitals and Dr. Ashima Kaura. So thank you, Cordlife. Cordlife is one of India's leading stem cell banks. And thank you, Dr. Ashima, for giving us this opportunity to speak to all of the mamas. So without taking more time, I've done all the introductions and all the thank yous. Let me just get right to the topic for the day, which is labor and delivery and pain management during labor. So we'll start with a little bit on pregnancy. And I'm so glad that when ma'am did the introduction, she did a little bit of, that there is a prenatal preparation also involved. Sometimes, we have mothers, they'll come to us and they'll say, just tell us how to do the breathing during labor. I just want to learn that. And I'm like, that's not practical, because what we have to do is we have to ensure that we are preparing you. Think about it like this, right? Today, if I want to run a marathon, I cannot just get up and go for a run. I will definitely, fall down somewhere in the middle, and I will fail in that endeavor. But if I prepare, if I follow a healthy diet, if I exercise, if I kind of, prepare my body and kind of, go through the rigorous training, I will surely be able to complete the marathon without any difficulties. And that's exactly what God designed pregnancy for. So He gave you 9 months to prepare you physically, mentally, emotionally. Yes, we are making the baby also, but along with all of that, this preparation is very, very important. And here are a few things that we would like you to keep in mind. The first is obviously a healthy diet. The second would be regular exercise. The third is keeping away from myths. And the fourth is a relaxed and stress-free mind. So I'm going to touch on each of these a little bit because my focus is obviously labor pain management today. But these are important, so I'm going to touch a little bit on all of these to kind of give you a little overview on how you should manage these during pregnancy. The diet that you're eating is not only going to nourish your baby, it's going to keep you healthy, and it's also going to build your immunity. I think today everybody in the world is talking about immunity, isn't it? So that word is a huge one right now, and it makes a lot of sense that you eat well and you eat healthy. So what we want you to do is eat a balanced diet. Everybody knows what is healthy. If I ask you, is a salad healthy? Is roti sabzi healthy? You'll all say yes. And if I ask you, is chocolate cake healthy, or is pani puri from the roadside dhaba healthy? You'll say no. So we know that. We're smart enough, we're wise enough. But still, we don't eat a balanced diet. And what do I mean by a balanced diet? I mean your 5 fingers. It's as simple as that, right? So what I want you to do every time you're eating your main meals, your breakfast, lunch, and dinner, you are going to look at your hand and say, okay, I have 5 fingers. Am I eating 5 different things? And that is what will help you to balance your diet. Now, what are these 5 different things? The first is your carbohydrates, which is your roti, your rice, it can be your upma, poha, dosa, idli, whatever. Any grain item is your carbohydrate. You need to make sure this is a unrefined carb. So don't look for the refined grains like white rice, maida, etc. Okay. The second finger that you're looking at is you are ensuring that you're eating some fruit or some vegetable. If it's a main meal, you can have vegetables. If it's a breakfast meal, you could have a fruit. So having a fruit or a vegetable at every main meal is very, very essential because it helps to give you, all your antioxidants, your vitamins, minerals, phytonutrients, all of those nice words that we keep using. The third finger is your protein. Now, this one's really essential because protein is known as the building block of cells. It helps to form your baby. It helps to grow your baby. And you know what? Here's a secret. It also helps in brain development. So make sure that you eat adequate proteins. If you're a vegetarian, a little extra focus is needed because vegetarian diets are generally rich in protein. So when you're serving your meal, don't just have roti sabzi, get that dal along as well, or have a bowl of chola or rajma, or something in your meal which constitutes for a protein item, right? The fourth finger is your calcium. Now, calcium builds bones, calcium builds the nervous system, calcium also builds your baby's teeth. The baby is going to probably get from your body, but then your bones will get depleted and you will have, problems later in life. So making sure that you have enough calcium in your diet, so 3 servings of milk or milk products on a daily basis is very important. So have that bowl of curd along with your lunch and dinner and have a glass of milk with your breakfast. That can help you to take care of that component. Now the last one's really interesting, but as you can see, I'm using my little finger for it. And this is your fats, oils, and sweets. So fats and oils are very essential because they help you to absorb certain fat-soluble vitamins, but that doesn't mean that you need to eat a whole lot, right? So make sure that you have healthy fats. Try to get in the unsaturated fats. So these come from your olive oil, they come from your flax seeds, almonds, walnuts, and of course a little bit of saturated fat. If I have to choose between vegetable oil versus ghee, I would prefer that you have a little bit of ghee. So your total is about 6 teaspoons in a day. Now, as you know, your baby is inside you, eating 24/7 because it's attached to your bloodstream. So we need to maintain your sugar levels, which is why it's recommended that during the time that you're awake, you should be eating every 2 to 3 hours. That's essential. Drink plenty of water, and we'll generally recommend about 10 to 12 glasses in a 24-hour period, which is about 2.5 to 3 liters, which will help to keep you hydrated, help to digest your food, and maintain your amniotic fluid levels, which means it will help you to prevent preterm labor to a great extent. Now, in spite of all these lovely things, we are still going to take our prenatal supplements, your iron, your calcium, your folic acid if you're in early pregnancy, a multivitamin, omega-3, whatever your doctor has prescribed to you. So make sure you take those supplements because we only have a short time to make that perfect baby, right? So we can't take a chance. We must not take a chance. Okay? Diet-wise, there are lots of myths that are there during pregnancy which can cause a lot of stress. But the most important myth that is there is, the fact that I have a lot of ghee in the 9th month and it will make my baby just slip out, which is absolutely not true, right? Another myth that generally surrounds labor and birth is that in the 8th month, if I deliver, it's a big risk. 7th month babies survive, 8th month babies don't survive. That's not true. The longer your baby stays inside your body, the better it is for the baby to come till full term. So that's very, very essential. So stay away from those myths. It just causes unnecessary stress. When we talk about stress, it's really good to be relaxed. It's good to be stress-free because your baby is getting the same hormones. So we don't want stress hormones to flow to the baby, right? So practice a little bit of relaxation, meditation, deep breathing, all of this on a daily basis. Try to keep negative thoughts away, and some things like don't eat black foods. Kala jamun, if you eat, the baby is going to become dark. Have something white first thing in the morning, the baby will become fair. These are all myths that we need to stay away from. Now, exercise is something which is very important. It is going to help to prepare your body for labor. That's a big one. Even if you know that, okay, there is some issue due to which I'm going to have a planned C-section, it will still help during pregnancy to reduce your aches and pains. Exercise releases endorphins in your system and it helps to relax you. It will help you to sleep better. And you know what? Mothers who exercise actually have a baby in the womb who's exercising too. So we see better heart function, better metabolism in these babies. So overall fetal development is also highly benefited. Now, first is very important. You need to make sure you take your doctor's permission so that you can, start your exercises on a regular basis. Do not start without getting permission. If you can, get an antenatal class, that's definitely helpful, but you should take that up only under guidance. Nowadays, it's become really easy. We all have online classes. So we have nice live online classes. You don't even need to leave your house. You can exercise in the comfort of your home. So think about it. But if you cannot, for some reason, then you can definitely take up walking. So walking is the safest exercise, but that doesn't mean that you just kind of, pick up your phone, go chatting with your friend, and you're strolling along for a walk. That doesn't make sense. So what is very important is that you strap on some good shoes, drink some water, have a small snack, and then head out for a brisk walk. I know many times mothers are asking me this question, is it safe to go outside? Yes, open air is generally safe as long as you're not going to crowded places. Try not to interact with people, and if finish your walk and come back, and always make sure that you're wearing your mask and you're sanitizing your hands, and etc. Whatever exercises you're doing, you must include some breathing exercises in your routine as well. Here are some exercises which, first, if your doctor gives you permission, and second, you can start from your 28th week, which is in your third trimester. So the first exercise is your pregnancy squat. The picture is showing a woman doing the squat without support, but during pregnancy, because it might be new for you, I would recommend that you use a firm chair or against a wall, or hey, even your husband, you can hold on to him and do your squats in that fashion. So legs are nice and wide apart. Make sure that you come down tall and straight so your back doesn't hunch or bend, and you are doing a nice wide squat. We generally recommend start with about 8 to 10 squats every day, but that's too little. So slowly, as your strength and stamina build up, you can increase your counts as well. The second exercise is very popular. It's known as the butterfly position. Can be done anywhere, anytime, even while watching TV or talking on the phone. Just get your legs in this position, bring your feet as close to your vaginal area as possible so that you feel a great stretch in your inner thighs. And you can either flap, so kind of, take your knees up and down, or you can even hold that position for a few minutes and then release and then again hold. So there's no excuse to not doing this exercise. It helps to widen the pelvis, creates more space for the baby, and it obviously prepares you for a birth. The third exercise is what I'm calling leg raises. I would recommend that you do this on a mat. So lie down on your side and fold your lower leg, as you can see in the picture, and raise the upper leg if possible to 90 degrees. Again, we're starting with about 8 to 10 counts for each leg. And then you can, increase as your strength and your stamina builds up. The lady who is in the pink, sitting on the commode in the bottom right hand of the screen, is depicting Kegels. Now, I'm not asking you to do this in the bathroom, but the reason why we have the bathroom picture there is because Kegels are your vaginal exercises. You have to imagine that you're stopping the flow of urine and releasing. So it's hold, and it's release, and it's hold, and it's release. What you have to make sure is that you do not hold your breath, you do not tighten your abdominal muscles, you predominantly just hold and release your vaginal muscles. You may feel a little bit of movement in the anal area, which is normal. So don't worry about that aspect. Now, how many to do in a day? I would recommend starting with about 50 to 75 every day and then increasing the number of counts. Doesn't mean that you have to do all 50 one after the other. You can do 10 and then after some time another 10 and another 10 and so on and so forth, right? The last picture is showing deep breathing. And I would suggest that all of you who are sitting there at home do some deep breathing exercises with me while we are here in this session. So sit back, relax, close your eyes, take a deep breath in all the way to your lower abdomen and exhale. Do not hold your breath anywhere. Inhale, exhale, inhale, exhale. One more time. Inhale, exhale. Right? We're going to do about 30 to 40 deep breaths every day, and it's a good idea to do this in a non-air conditioned environment. Better to do it in the morning because we expect the air to be the freshest in the morning. So practice these exercises every day from the 28th week onwards once your doctor gives you the green signal. In addition to this, you can do some walking, and this will help you to prepare for your labor and birth. We expect and we call full term to fall between 37 to 40 weeks. If you start getting any of the symptoms of labor before 37 weeks, please report to your doctor immediately. We'd rather that the baby stays inside. So if you go in early, the doctor may be able to stop things for you, slow things down, buy you some time, and buy the baby some time, because having a baby in the NICU is of course stressful for us as the medical team, but it's also very stressful for you as the mother and for your whole family. So, and I didn't even say it's stressful for the baby, but yeah, even the baby gets separated from the mother, and that's so stressful for that little baby. So it's very important that you cross your 37th week. And if you see any of the signs and symptoms that I'm going to talk about now, please make sure that you get in touch with your doctor immediately. Right? So if it happens before 37 weeks, if you get your pre-labor signs, please report to your doctor. Now, what happens 15 days in advance before labor is supposed to start? So I always tell my mamas this, you know, there are 3 due dates out there, and you'll be like, whoa, 3 due dates? What's happening? So the first due date is what you got as soon as you found out you were pregnant, which we call your expected due date as per LMP, which is your last menstrual period, right? Now, after that, you keep getting different due dates when you go for your ultrasound. So we call that your expected due date as per USG, right? So that's your ultrasonography. What happens in the USG is that the doctor is observing the growth of the baby, and as per the growth that he is observing, he predicts that the baby would come at so-and-so time. And that date can be radically different by plus or minus 15 days from your date as per LMP. So this is normal. If the date is a little more up and down, then we worry. And the third due date that is there, no one knows. Your doctor doesn't know, I don't know, you don't know. It's only God who knows, right? Because that's when the baby is decided that the baby wants to be born. So 15 days prior to that date, we see that the baby starts dropping. So the baby lives in the uterus. It is able to somersault, move around, and etc. Towards the 9th month, the baby kind of turns into a head down position, which is normal. So by about 32, 33 weeks, the baby is in a head down position. And then after that, the baby has to enter the pelvis. So when we say the baby is engaging, the baby's head is entering into the pelvis. And this happens about 15 days in advance. The mother will start feeling that she has a lot more space in her upper abdomen, her stomach, which was looking and feeling like a watermelon. She had a lot of breathlessness, could not eat too much, loss of appetite. Now suddenly her stomach looks like a pear with a lot of weight in the lower abdomen. So that is a good sign. If it happens around week 37, then we're really good with it. Then there is the Braxton Hicks contractions. We call these fake contractions. but they're no way fake. They're definitely real. They're doing some exercise for the uterus, but the only difference is that they do not open the cervix. So they're fake contractions because of that. They're short, they're painless, they're sporadic. So we don't have a pattern for them, right? But in the last 15 days, we see that they seem to increase in number. So if you're kind of feeling, your abdomen tightening often in the last 15 days, then you know that, oh, okay, I think I'm getting some pre-labor signs. The cervical changes can be observed by your doctor. All through pregnancy, your cervix is long, thick, and tightly closed. But as labor approaches, the cervix starts becoming shorter and softer and a little bit thinner. So this is something that only the doctor can observe. You and me will not be able to ascertain this. 48 hours prior to the actual onset of labor, most mothers will lose what we call the mucus plug. So this long, thick and tightly closed cervix, which has been shortening and softening, is also blocked with what is called mucus. And because the cervix has now become shorter and softer, the mucus plug doesn't stay there anymore and falls out. So if you see a lot of mucousy type of discharge, and it could be streaked with blood, then that could be your loss of mucus plug along with a bloody show. So the blood has to be very little. It has to be just streaks, maybe pinkish, brownish. If it's bright red and if it's large in quantity, if it looks like the start of your period, then you must definitely let your doctor know. It could be a warning sign. Getting loose motions, multiple bowel movements prior to the onset of labor is very, very common. So you may have been a good girl and you have not been eating food outside, but you still end up getting loose motions or multiple bowel movements. That can be common. Getting spasmic back pain. So getting dull back pain, which goes away when you do a massage, change your position, rest, and etc., is a pregnancy thing. But if you're getting like cramps in the back, like spasms in the back, and then they go away, then these could be your pre-labor signs. In spite of all of these, you seem to have high energy levels, and that's completely normal. At the onset of labor, you are going to have regular contractions. So now the difference is the contractions are going to have a pattern. There is going to be a rhythm to it. They will feel like period cramps. So if you've not experienced period cramps, don't worry. You will get a chance to feel what a period cramp is like right now, but they're a little bit more intense and they're definitely noticeable. As labor progresses, the frequency and intensity of these contractions is going to go on increasing. And a quick tip to understand whether it's real labor or not is simple. Activity increases the intensity of the contraction. So if you're feeling a contraction, just simply get up and walk around. And if it subsides, it's probably false labor. But if it becomes more intense, it is the real thing. Here's what you should do to time your contractions. Now, this is very important because when you call your doctor is going to want to know what's the frequency, what's the duration, right? So the duration is from the beginning of the contraction to the end of the same contraction. And frequency is from the beginning of the contraction to the beginning of the next contraction, right? These are two numbers that your doctor will want to know. What's the frequency and what's the duration? So maintain a chart. You do have a lot of apps nowadays which help you to record your contractions, or you can do good old paper and pen, and that's good enough too. In between contractions, as you can see on this picture, there is a period of relaxation, and that is completely normal. So what we're going to do in that period of relaxation is recover, rest, and get ready for the next contraction because trust me, it is going to come. When should you go to the hospital? You should go to the hospital when the contractions are regular and they're about 20 minutes apart. That's the general time because even after this, you generally do have a good number of hours to go before the baby actually makes an appearance into the world. The other reason to go to the hospital is when the water bag breaks. So your baby lives in a bag of waters. This is called your amniotic fluid. When the water bag breaks, the sterile environment of the baby is now open, and that is obviously something which needs to be monitored. Most doctors will want to deliver the baby within 24 hours of the bag of water is breaking. So if you wait along at home and then you go in really late, then we don't have any other option but to do a surgical birth. So if you want to get a good chance at, maybe trying to induce labor, if labor doesn't start, then make sure that you go immediately when you feel the leaking. So it could be leaking or it could be a gush of fluid. If you identify that it is the amniotic fluid, get to the hospital. You don't need to panic. It's normal. It happens. We generally have mothers asking, what will happen first? Contractions or bag of water is leaking? Either or. It doesn't really matter. Sometimes contractions happen first and the bag of waters breaks well into labor. Sometimes the bag of waters breaks first and then the contractions start. Sometimes the bag of waters breaks but the contractions don't start and the doctor has to artificially start labor. And sometimes it can also happen that the contractions start, labor progresses, you're 10 centimeters dilated and the bag of water does not break. So the doctor has to break it open manually to get the baby out. Another reason to go to the hospital is if you or your partner are feeling nervous, because one of the golden rules of labor is the more relaxed a mom is, the faster labor progresses. So if you are stressed out, if you're tense, if you're worried, or if your partner is worried, so if the mother is sitting and breathing away like Gautam Buddha, but the father is parading all over and asking when to leave, should I pack this, should I remove the car, then you better take him to the hospital. That would be a heartfelt recommendation. If the hospital is very far away and you kind of, are certain that, it's peak traffic time, it's going to be difficult to get there, maybe it's some festival, maybe it's, the rainy season, whatever. If you feel that there is a reason why you could get delayed going to the hospital, then you might want to leave a little bit earlier. When you arrive at the hospital, the doctor will check you. If you are in labor, you will be admitted. If you are not in labor and it's a false alarm, you will be sent home. Don't worry, it's okay. It happens with the best of the best that you do not identify the real labor contraction in spite of having all this information. Right? So your vital signs are monitored, baby is checked, and then labor is allowed to progress naturally. We really, really don't need to do anything. The first stage of labor is called effacement and dilation. This is when the mouth of the uterus, which is the cervix, is going to first going to become short and thin, and then it is going to start opening. So it has to open to about 10 centimeters, and that's the size of the baby's head. In the second stage of labor, the baby is delivered. So the mother is asked to push, and with every contraction, the mother's pushing effort is also there. The doctor will surely guide you, and the baby makes its entry into the world. The head is delivered, and the baby is going to rotate, deliver one shoulder, deliver the second shoulder, and then the rest of the body just simply slips out. Now we're all waiting for the delivery of the placenta. At this point of time, the umbilical cord is clamped. If you have opted for stem cell banking, then your cord blood is collected as well. And the placenta is going to detach itself from the wall of the uterus. It just happens very spontaneously, very automatically, and it will exit from the uterus as well. We call the placenta the afterbirth or the slave of the baby. So once the baby is gone, then that's also not required. So it becomes a redundant organ in your body, and the body will expel it in a natural method. So now, as I told you, how do I manage pain? So I've explained to you all that happens during labor, that you've got a little bit more of a bird's eye view of what to expect. So that also reduces your stress levels. You kind of are not completely in the unknown now. But one of the important things to remember is that stress always causes pain. So the more relaxed a mom is, there is obviously less stress, and therefore there is less pain. The less pain that a mom experiences, the faster labor is going to progress. And obviously, that's going to keep her more relaxed, less stress, less pain, and it's going to be that entire cycle. So therefore, we say that the best labor management tool is actually stress management. So now I'm going to teach you some magic tricks, right? Which is going to help you to manage labor. I don't think you expected that on this Sunday morning, we're going to do some abracadabra, but that's exactly what we're going to do. We're going to learn some magic tricks, which will help you to take care of your labor very, very simply. Oh, this one's really tough, right? All the movies that you've seen have women screaming and delivering the baby. And here you're being told that, oh, it's a magic trick, avoid screaming. But really, it's really, really true. You should avoid screaming, because if you are going to scream, you are going to tighten yourself up, you're going to use up a lot of energy, and you're just unnecessarily going to get exhausted. So try and avoid screaming. I'm not even going to say it's going to affect the baby. The baby will be traumatized now. The baby doesn't really care. But your body will be really tight, and it'll be difficult for you to kind of, have the baby descend further. So avoid screaming. That's your first magic trick. If I'm not going to scream, then how am I going to manage myself? How am I going to distract myself? And I'm going to distract myself by breathing. And that's something which is really, really important, that you do your deep breathing during labor. Now, when you're doing your deep breathing in early labor, that helps to keep you oxygenated. There will come a point of time where you will not be able to deep breathe. You will have to do short breaths. And here's how you're going to do your short breaths. I'm going to show you one, and then I'm going to ask you to do a couple of them with me, right? So here's how a contraction is going to look. When the contraction starts, you take a deep breath in, prepare your body, exhale. Now place one hand on your chest and place the other on your abdomen, the way it's shown in the picture, and switch to short breaths, which is breathe in through your nose and blow out through your mouth. So it looks like this. So what I'm doing is I'm breathing in through my nose and I'm blowing out through my mouth for every breath, okay? It's not one deep breath in and multiple breaths out. It's in and out, right? And then when the contraction is gone, I will take a deep breath in and I will relax. So remember, there is a period in between contractions, which is your relaxation phase. And that's when you are going to just be calm and you're going to do your normal breathing, and you're going to recover and you're going to rest, because then when the next contraction comes, you're going to go back to your short breath. So should we try a couple of these labor breathing with us? I'm going to do 30-second contractions. Ready? Take a deep breath in, exhale, inhale, exhale. Breathe in through your nose, blow out through your mouth, short breaths. And you can feel the contraction disappearing. So take a deep breath in and relax. Close your eyes. Just relax. Try and keep your thoughts neutral. Loosen out your body. See where there's the tension. Don't scrunch your forehead. Relax your shoulders. Loosen out your fingers. Don't scrunch your toes, just sit back, recover. Think about the baby, think about nice things. Don't think about anything negative at this point of time. And the contraction is coming back, so prepare yourself. Take a deep breath in, exhale, breathe in through your nose, blow out through your mouth. And you can feel the contraction disappearing, so take a deep breath in and exhale, right? Now, what I would like you to do is the way we've practiced today. We did 30 seconds. You can do about a minute. Once you reach about 28 weeks of pregnancy, you should do this on a daily basis 5 times. So make sure that you do your contraction breathing practice every day. Give yourself the same auto suggestions. Kind of tell yourself that a contraction is coming. You need to switch over to short breaths, because it's going to help you to cope with the pain. When you do this on a regular basis, it becomes second nature for you, and that is very, very important. The third magic trick is that you should visit the bathroom. Yay! What a trick, right? But let's understand this. If you look at this diagram that is there on the screen, the image that is there on the screen, this thing in the center is the uterus, and that's your birth canal. Right? If you can follow my cursor on the screen, that's your birth canal. And then you have your rectum, and then you have your urethra, right? From where you pass your urine, so that's your bladder, right? Now, remember we said that you get multiple bowel movements before the start of labor. So nature has designed it in such a way that the bowels are emptied out, which gives more space to the birth canal for the baby to come through. If you were to pass urine every 45 minutes to an hour, you will create more space. Your bladder will also be empty, so there'll be more space for the baby to come through. Another good thing is that when you are passing urine, you are sitting with your legs a little wide apart, so you do tend to get into the right position. And the other advantage is that you cannot be tensed and pass urine. You will have to be relaxed when you pass urine. So that becomes really, really essential and important. Try to be in an upright position, because when a woman is lying down, her birth canal is not flat like this. It's actually to an upward tilt like this. So what the baby has to do is the baby has to kind of make an upward climb towards, coming out of the womb. And therefore, it's important that if, wherever possible, if you can sit up, it will give you the advantage of gravity as well. Last but not the least is move. If you're permitted, if you're not attached to any IV, etc., moving around will help. Think about it. If I have a pillow with a tight pillow cover on it, how will I remove it? I will shake it, I will pull it, I will tug it, I will do some action to it, and I will get the pillow out, right? So the same thing happens even during labor. Your baby is that pillow, your uterus is the pillow cover. So make sure that you kind of, do these movements. That will help the baby to come out much faster. Having your partner do some gentle massages during labor can also help to relax you, because it will help to ensure that, your body releases good hormones, oxytocin, which will help the body to relax and, stay comfortable in the duration of labor. So a little bit of back massage right there, which is where the major pain happens, right, during pregnancy, during labor. So a little bit of back massage can be very helpful. A little bit of shoulder and neck massage can also help the mother to relax and reduce her stress and anxiety, and she can then proceed with the contractions a lot more easier. Some others might even enjoy a little bit of rub on the belly, because the belly is hurting, but the rub on the belly has to be really gentle. It can't be very harsh or it's just more like an effleurage kind of a touch. Some of the natural pain relief options are helping the mother to relax, her breathing exercises, as we've taught you, some gentle massage, imagery where you're kind of, imagining some positive things like maybe your honeymoon, walk on the beach, flying like a bird, imagining your babies, a lot of things that you could do imagery about. And also diversion techniques. I had one client who loved, the Friends serial, and she put them all on a portable DVD player and took them along with her to the hospital so that she could laugh her way during labor. So whatever works for you. For some people, it could be some chants, some mantras, maybe a little bit of aromatherapy, watching some favorite TV show, just meditating, whatever helps to divert your mind can all help you with natural pain relief. Before you think of eating and drinking during labor, please check with your doctor, because eating large meals can actually cause vomiting, and it will also be risky should you need an emergency surgery. So always check in with your doctor before you start, having a party in the labor room. But you can sip on a little bit of water, or you can suck on ice chips, because this will help to keep you hydrated. Looking at some high sugar foods, but in tiny bites, such as maybe a glucose water, some soft sweets like, the little candy sweets that we used to eat when we were children, glucose biscuits, or small tiny bites of chocolate. This can keep your sugar levels up and therefore energy levels up. And these are tiny bites, so you don't kind of, have too much of a risk of throwing up, etc. There are some medical pain relief options. So there is epidural analgesia, which is injection given in the lower back. You can speak to your doctor about this. For labor which is lasting really long, an epidural can be a very good option. It can actually help to relax you. Many times what happens is that if labor is too long, the mother can end up then not being able to push effectively. So that can become a challenge, that can be a problem, and therefore if it's a really long labor, if it's really painful, then you might want to consider the epidural analgesia. So do speak to your doctor about this. A spinal block is used generally for a cesarean section. It gives you complete pain relief and for the duration of the surgery. So the epidural is generally used with a catheter so that it can be replenished. It can be a constant pain relief for a longer duration, and the spinal block is for the duration of the surgery, but it's complete total pain relief. There's also Entonox, which is available in some facilities, which is also known as laughing gas. But this is for short-term relief where, you're almost there, or you just need to kind of, get through certain rough patches, because you literally have to inhale it. It gives you a short relief spell, and then the pain again comes back. So you have to again take it. So it is a very short-term method. But for mothers who are almost there, who are ready to deliver any minute, this could be an option that you can discuss with your doctor if it's available. A surgical birth may happen because of planned or pre-existing conditions. So maybe, we know that the baby has some problem, maybe the mother has certain conditions. So these could be, or you will know about this in advance. Your doctor will talk to you about it right from the word go there, right? Some conditions are unplanned and they can happen during labor. Some of these are the cervix does not dilate. I mean, we've spoken so nicely about the cervix opening up, but it just does not. The baby does not move down. The baby has some kind of distress. The heartbeat is being erratic during a contraction, or the mother develops an infection during labor. So all of these could be reasons why a mother has to undergo a surgical birth at the nth hour, in spite of everything being super healthy and super normal. You must remember that a surgical birth is done to save lives. We should not take it as an option for convenience. So do not go to your doctor and say, oh, I want this auspicious date, or my mother can come at this time, or etc., etc. That is not something which is an option or a choice for you. It is done to save lives. It is a major abdominal surgery. So always keep that in mind. That is really, really important. Please remember, birth is a new beginning. Look at that cute face, right? How else do we welcome it except with positivity, isn't it? So welcome your baby. Look at your delivery day as a happy day, because it's what's going to change your life. It's going to bring joy to your life. And that's something which is a positivity that you should always keep in mind. D-Day is your delivery day. It's a delightful day. It's not your dreadful day, right?
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
And here is an absolutely special offer for all of you. This is brought to you by Cordlife and Mama Earth. Mama Earth is a product which is made out of natural ingredients, and it's primarily for skin and hair care. So you can use it during pregnancy, and it is also available for baby care. So you can use this for stretch marks, maybe some nipple butters, baby massage creams and oils. So there are lots of options which you can try for. And once the session is over in about 48 to 72 hours, the Cordlife team will be in touch with you and will share this voucher with you, and also how you can go about using it. So make sure that you do take their call as they will share the recording as well as this voucher with you. These are some books which are written by me, and they are available on Amazon. There's prenatal fitness, which is for exercise during and post delivery, and also some dietary suggestions. It has lots of pictures and a lot of guidance, so you can do the exercises safely once your doctor gives you the permission. Then I have parenting mantras, which is for life after baby. So it's a nice little cute short way of covering all the little problems from teething to toilet training to breastfeeding to sleep scheduling and diapers and etc. So it's a must have for all parents as a quick reference guide. And when your baby starts eating foods from outside, we have the Super Mom's recipe book, which you can also use to make some delicious foods for your little one. We are going to now keep the floor open for questions, but I've also put in some personal coordinates here. This is my website, my Facebook and Instagram handles. Make sure that you follow me. I do a lot of fun stuff on my Facebook and Instagram pages, and it's a very active page. I also have a YouTube channel, which is the Pregnancy Coach by Baby 360 Degrees. We have a free pregnancy tips group on WhatsApp. So if you make a note of this number and drop a message and ask to be added to the free pregnancy tips group, we will get that done for you as well. And then I have also given you the Cordlife numbers. So the Cordlife numbers are on the screen. You can choose to call them. You can choose to WhatsApp them. There's a toll-free number and there's also an SMS number. So you can take your choice as to what works for you, and definitely get in touch with the team in case you don't get a call, you don't receive your recording, your voucher, or if you'd like to kind of, take a presentation and understand more about stem cell banking, right? So I'm all set now. I'm going to open up my questions section, and I hope you have a lot of questions for me. All right. So the first question that I can see is the pace of the walk and the distance of the walk also important? So the pace of the walk becomes important because we don't want you to be strolling. We want you to be focused on the walk. So as long as you're not getting breathless, that's the pace that you're supposed to follow. Keep that in mind, right? If you're getting breathless, then that's something that you're doing too fast and you should slow yourself down. Now, everybody's pace is different of feeling breathless, and that's the important thing to keep in mind. So you should be able to walk and talk, but you should not be very happy about the talking. That's the pace that you follow. Now, as far as the distance is concerned, if your pace is a little bit slower, so we cannot really prescribe a distance, but we normally say that a 30 to 45 minutes walk every day at a pace that you can walk and talk is recommended. The next question is, can I do exercises in the 3rd month? So I've always been constantly saying all throughout the session that for exercise, you should always consult with your doctor. So typically, yes, exercise is allowed in all the stages of pregnancy, but it all depends on your pregnancy health. So you need to check in with your doctor. Very important is that you should not start anything new during your pregnancy. So if you have not exercised and you suddenly decide that you want to start in the 3rd month, that may be a little bit of a risk factor. But if somebody has been a regular hardcore exerciser, and if your pregnancy is healthy, then you can exercise even in the 1st trimester. Epidural is given in a vaginal birth. That is the whole idea of pain relief during a vaginal birth. My next question is from a mother who says she's in her 27th week of pregnancy, and before pregnancy she had endometriosis. Is it compulsory that I will have a C-section? Ma'am, this is really going to depend on your pregnancy condition. It will depend on the doctor. So it's not necessary that you will have to have a C-section, but it will depend on how the pregnancy is progressing and the condition at the time of birth to make a decision on this particular situation. So I have a mother who's been diagnosed with alopecia. This is a skin condition. No, it is not transferable to the baby, so don't worry about it. But do get it treated because you don't want to have patches of balding on your scalp. Is there any particular criteria for counting baby kicks? So we generally recommend that. So let's start with when you feel the first movements. So you would feel the first movements between week 18 to 24. That's common. The initial first movements will feel like little flutters, little kicks. They will be almost negligible. So some people might even call them gas bubbles, and that's normal. But as your pregnancy progresses, so between 24 to 28 weeks, the intensity will increase, and you will start feeling that there could be proper kicks and somersaults and etc. happening. By the time you reach week 34, 35, the number of kicks will remain the same, but the intensity will reduce because now there's less space. So the baby can't really kick too much, the baby can't really somersault too much. So it'll be more gentle movements at that time. So this is normal. The criteria that we follow is 10 movements in a day and a proper activity period of about 10 movements. If it happens continuously, then that is considered to be normal. But what you have to remember is that your baby's movements have to be your baby's movements. So you keep your pattern, your chart, and that's what has to be followed. Is it okay baby's movements slow down sometimes? Well, so, there are certain durations of the day when the baby would be sleeping, the baby would be quite inactive. Generally, when the mother is moving around, when the mother is active, it's like a swing for the baby will have less activity at that time. When the mother is eaten her meal generally and then is resting or lying down, we see the activity increases at that point of time. So that is normal, that happens. But if you find that, if you've had something sweet and you're resting and you're doing your deep breathing and still the movements are not happening, then you should get it checked, because that could signify that the baby is maybe not completely comfortable. Yeah. Anybody with any question, we'll just wait another minute and see if there are any questions. Also, we would be really happy to get some feedback. If you've enjoyed the session, please do share your feedback in the question box itself. It's a good learning experience for us. And if there are any other topic suggestions that you have in mind that you would like to see such webinars, you please put those topic suggestions also. So we'll wait another minute or so if there are any more questions, and plus we'd love to get your feedback and your suggestions. So please do put those in. As far as the requirement of husbands, it's a question that you'll have to ask your maternity home. You'll have to ask your doctor, because it really depends on the situation. Sometimes what happens is, if there is right now, currently especially, there's a huge rise in COVID cases and etc., the hospitals might be reducing the number of visitors, attendance with the mother. But generally one person is allowed, and it is the husband. All right. So thank you very much, everybody. Thank you for attending the session today. And you can give your feedback. Okay, which side should we sleep? So all through pregnancy, it actually depends on what you feel comfortable. The best recommended sleeping position during pregnancy is on your left side, because that's when the oxygen flow to the baby is the best. And your digestion also is optimum when you sleep on your left side. But if you sleep on your right, or you sleep on your back, like you find yourself on your back in the middle of the night and you wake up and you say, oh my God, I'm on my back. Don't worry, it's not something which is alarming. So you can definitely take some rest. You can sleep on your back occasionally as well. All right, great. So is there anything like we should not sit legs folding? No, not at all. You can, those are all myths. You can fold your legs and sit. You can stretch your arms above your head. When you turn, like, in the night, if you want to turn from the left side to the right side, you don't need to sit up and turn. You can just turn. Those are all myths. I already answered the sleeping position. All right, great. So thank you. Thank you very much, everybody, for joining us. We would love to get your feedback. If you miss putting it here in the chat, you can put it offline as well. I have already shared my website address and my WhatsApp number and etc. So you can use any of those or the Cordlife numbers to share your feedback. Thank you. Thank you very much for joining us this morning. I hope you learned and had a great experience. We look forward to seeing you again very soon. Thank you, Cordlife. Thank you, Dr. Ashima Kaura, for giving us this opportunity to speaking to everybody. Have a great Sunday. Enjoy the rest of your weekend.
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new rule. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.